Namaste. I welcome you all to this session number 20 of Gurubodha series. We have with us Dr. M.B. Guraja sir. Coming to the topics for today, the first one is a question asked by one of our participants. So, in case of head injury, which is leading to loss of sense of smell, so, what can be Ayurvedic treatment or how to go about approaching the case? Guraja sir, can you please elaborate on this case?
See, first of all, we need to evaluate and ascertain whether the injury to the which part, whether it is of nose or at the level of even a higher centers, or where the cognitive centers related to the smell and all those things has been disturbed. If you go through some MRI and that type of things, and if it is required, some nerve conduction test. Of course, may not be sometimes possible with the head injuries, but usually we will go with the MRI scan and the CT scan, which is a supportive to a conclusion. When there is a loss of smell post a head injury, it is not a good sign, first of all. And we need to have a sense of smelling, and this thing should continue to be called as a human being is normal. So here, what are all the available options for a treating physician? What can be done? First thing is to establish level of Kavaigunya, where exactly the lesion has taken place or where there is a discontinuity in the cognitive function, the smell has been gone. So once we establish particularly this kind of thing, then we can assess whether it is possible to treat through Ayurveda or not. Then we need to go for in such a manner that what are the Uttamanga related procedures which can definitely going to scope or help us in giving out some results. So in this thing, the therapies which are aimed at the head or Uttamanga is Shiro, pichu, Nasya, Shiro, these things. So here, before doing any Shiro, pichu, Nasya, Shiro, or something like that, better we need to assess the damage. If the damage is severe or it is somewhere down the line, even the entire cognitive track where the smell has been perceived and assessed and it has been given a feedback, if any such type of damage is there, whether such things can be managed through Ayurveda, then we need to go for something which is Nadi Balya, like Danvantram 101 Nasya, or some Tarpana quality Nasyas, Shirabala 101 Nasya, or if there is any Avarana which is leading to the blockage, which is leading to the Sanya Nasha of particularly of smell, then it is better we go for Avarana Bhedana type of things. So when Avarana Bhedana type of things are there at our disposal, it is something which is Sukshma as well as it will be penetrating. So you can go for something like volatile oil containing materials like Shunti Rasa Yukta Nasya or Nimba Nasya, Nimbatala Nasya, something like that which can be penetrative in nature. Such type of things can be used. So, but before doing all these things, it is better to ascertain and evaluate and even conclude that whether it is due to Avarana, it is due to Vatakshaya, or it may be some nerve damage or something like that, whether it can be done or not. At sometimes, in these type of cases, we cannot say that results will be 100%, or we cannot say result won't come. By virtue of treating, many times it becomes so obligatory for a treating physician that the patient will say that you try, sir. So in that situation also, we need to try out what are the best possible ways we can handle these. So in that situation also, we can go for this type of tarpanas and nasyas, Shiro, pichu and basti and something like that. Of course, after ascertaining whether it is Avarana Janya or whether it is due to Vatakshaya. So based on that, we can finalize it. If it is a Nadi, something damage to that, or higher center being damaged, then it is difficult to get a result. If it is in the lower down somewhere, if it is a blockage or something like that, then it can be manageable and it can be re-established. The connectivity can be re-established. Better assess all these things and then go for the procedures. Definitely, it will going to help in that sense. And of course, being Nadi and Vatajanya disorder and these are things, and it takes much time usually. And quite a good time in getting these results in this type of cases is at least 3 months. 90 days to 100 days is a quite good time. And at least we need to do the treatment course till that time. If by 100 days also, if you are unable to get any result, convincing result, then it is not possible to give out any result.
Sir, thank you very much, there, sir. Especially if the injury happened like yesterday or today morning and the patient is brought in, ascertaining the extent of injury, doubting whether there is any internal bleeding, whether that bleeding is seeping into the brain areas leading to clot formation, all those things to ascertain that, like you said, an MRI scan or CT scan would be the priority. First thing, whether to rule out is whether there is bleeding or not. Sir?
See, in olden days, there was no such techniques were there. Maybe I don't know how our acharyas used to ascertain these type of things. Even head injuries used to occur even those times, and even pakshagat and this type of nadi aghatas and these type of things used to happen even those times. And I don't know how they used to ascertain and how they used to give results. But when we are living in 21st century, and we have at our disposal something which can be utilized, some technology is there. Now, why don't we utilize that? So we can go for utilizing the MRI or CT scan and such type of things, so that we can ascertain and come to a conclusion whether it is Avarana Janya or it is due to Kshaya Janya or there is some nadi which has been totally cut or something like that. Nerve conduction test, these things will definitely will give ideas. Based after that, then we can have some sort of prediction whether at the end of the 100 days of my treatment, whether we can expect some results or not. So it is better to go for that. And usually these head injuries happened, maybe two-wheeler skid or something like that, or fallen in the house in old age people. These type of things usually will have a head injury, and in that cases when they go for a scanning and these type of things, usually they say that patient will be observation for 68 hours or 96 hours, something like that. It's very clear reason is that the situation is liquid and it is molding and it is changing every moment. So it may ultimately end up in some level. So that has to be ascertained because it's a somewhat totally fluid situation. There's, if you repeat the scan on the day 1 and day 3, there will be changes. So based on that, doing something is always difficult. So it is better we need to understand there is a bleeding which has caused the avarana and there is something like that, or there is no bleeding, that's an infarct which has caused due to that, or a head injury has caused a concussive head injury or a non-concussive head injury. Based on those parameters, we can little bit plan out our protocol, what can be done, what exactly can be planned out. But still, in these type of cases, definitely it requires 90 days to 100 days to totally recovery or giving some good results. Beyond that, there is no meaning in trying.
Like you mentioned, the Shiro, pichu, Shiro, dhara, etc. procedures. Because nowadays public information regarding health is available more freely. Everybody is worried about post-traumatic stress disorder and other things. Overall, in any case of injuries, the vata dosha tends to aggravate. So probably with the external therapies which mitigate vata dosha, oral medicines such as Kshirabala 101, Dharmantaram 101, and to keep the inflammation low or to heal the inflammation, Dashamoola preparations, they can also be included. Can you please guide on the oral medicine strategy here, sir?
Definitely. See, when you find it out, it is a higher center which is involved and it is of vata and it is giving trouble in the way of vata, or in such type of conditions, if it is there, we can go for any vata management. So when we go for the vata management, it Shodhana and Shamana, In both the ways, it should be used. So it's very clearly, if it is Vata, then internally Snehapana and all these things are, whatever the protocol being laid down, holds good even in this condition. And as well as internal medications like Kshirabala, as you mentioned, even Dhanvantram and such type of things, and even Dashamoola containing drugs in the form of for a Svedana, if you are giving an Adisveda to a particular area, then putting this Choorna into that. The vapors coming out of this Dashamoola Kvata Choorna will also be helpful, and even the Maharasnati Kvata Choorna will be helpful. So something like Vata management, Vata has to be managed. So what and all the procedures can be done, all can be incorporated in these conditions. It may be internal or it may be external. All the both the ways, sir, it's always good.
And sir, regarding Nasya therapy that you explained, that Tikshna type of Nasyas, maybe neem oil that you explained, or even Lashuna Taila or garlic oil. So those are relevant only in the, say, maybe initial couple of weeks, and then we have to go for more of a soothing and vata shamana type of nasyas.
No, basic thing is that once we analyze the condition based on the symptoms, parameters, and of course the modern tools of imaging, CT scan and MRI. If you feel that it is due to Avarana, then till Avarana is broken, we need to go for a Tikshna type of things, and we need to ascertain like it is not due to bleeding. The internal head injury, or maybe that injury is concussive in nature, but there is no bleed, no internal bleeding. When there is no bleeding, then we can go for some shamana type of thing and a shamana type of thing or soothing type of thing and pacifying the vata. If there is a bleeding, initially we can't do it because once the bleeding settles down, that's why the reason that the 68 hours or 96 hours they'll take the patient care will be kept under observation, and the situation is will be definitely fluid in nature and it will be evolving. So in that time, it is better to observe, and once there is a stagnation in the pictures of these things, repeated scans or even MRI, then better to go for something penetrative so that it opens up. Avarana can be broken. So if it is initially, if there is a bleeding, we can't go for something which is breaking up in nature or breaks open. Only thing is if it is a type of Vataja Vyadhi, how it can be pacified, in that way it can be handled initially. Once there is a stagnation and internally it becomes a repeatedly same type changes in the areas of leak or coverage or what we call in the CT scan and something like that, then it is better that that time we can go for if it is in a bleeding as a previous cause is there or internal hemorrhage what we call it. In that condition, it is we can use it these type of penetrative things like lashuna or shunthi or something like that in the form of nasya with some soothing oils. But there is such type of avarana, it is purely because of the vata, then it is better soothing type of oil can be used. But usually in a head injury, if there will be some concussive nature and most time it will be bleeding. So when there is internal bleeding, we should be cautious in the initially. We should not cause further Ushnatikshna Dravya should not be given to increase the bleeding, because if you increase the bleeding, then more area comes under the coverage of the disease, then more vast lakshanas will be seen. So it should be better to avoid those things in the initially when there is a bleeding.
And there's a question here. Lin Wo asks, you mentioned about Dashamoola Choorna vapors can help in head injuries. Is the treatment done by boiling Dashamoola Choorna and inhaling the steam? There is also this Dashamoola Kshira Dhuma also, and probably Dashamoola Taila Nasya is also an option, sir.
See, whenever we are giving a Svedana followed by Snehana or oleation followed by fermentation, while doing fermentation simply just with the water we don't do it. We'll try to put something into the water like that. See, whenever nowadays in the Panchakarma setup, what we do is we try to put a pressure cooker which containing water in that potali is being put into that, and that potali contains the Vata Choorna or Maharasnati Vata Choorna, something like that. It will be subjected for boiling, and the vapors will be directed through the nadi. to the place where it is required. So if that is the condition, then it is better we can go for such type of drugs which is boiled and their vapors can be directed to the place where which is required. So by using Nadi Sweda or Bashpa Sweda, something like that. So definitely Dashamoola being and Maharasnati Vata Choorna being anti-Vata or pacifying in nature of Vata. So definitely it will be in these conditions. It is not directly inhaling the Dashamoola vapors. It is not inhaling. It is locally made to fall on the area where it is you feel there is an, for example, temporal lobe, there is an injury as per the CT scan or this one. So on the right side, on the left side, based on that, some vapors will be directed towards that, and that type of will be going to support in our way of handling these cases.
And kindly guide regarding the diagnosis of Avarana in case of head injury. So, in which are the symptoms that we have to observe to know that there is blockage of channels or bleeding and clotting? Which are the symptoms which suggest only towards superficial injury? Maybe palliative measures are sufficient.
See, that's the reason I said in the beginning. I don't know how our acharyas are able to say that it is due to avarana, it is purely vata, without having the support of these type of presently what we have as a technique of MRI and CT scans. But presently, I do with the help of MRI and CT scan. Wherever there is a bleeding, then it is definitely going to cause avarana. So I'll take this as an criteria of understanding whenever a patient of this nature comes to me for the CT scan and MRI or something like that of the brain, and I'll try to assess whether there is a bleeding or not, whether there is any infarct is there or not. If it is simply infarct inside, then it is purely obstruction in the path of vata, that is sangha. Then I can go for a penetrative thing because there is no injury to the vessel wall. But there is an internal bleeding, vessel wall is broken and the bleeding has occurred and it has been condensed into a clot and these areas have been covered like fourth ventricle is been covered or parietal area is covered or occipital area is covered. So such type of clarification whenever I get, I feel it is due to, I treat consider it as an avarana. Otherwise, just by outside observations or based on the lakshanas, it is difficult to say that it is due to avarana janya or it is purely due to vata. It cannot be done in that sense.
Yes, sir. Even when the patient will be looking very perfect when he visits the doctor when there is a recent injury, and when he goes home, he may have an epileptic shock, or he may have an epileptic episode, or like the present case where the smell is blocked. So it's very difficult to guess in an OPD setup just by the presenting compliance.
Definitely, the presenting complaints will be a very clue to us to come to a conclusion. While asking the history, we will try to take the history in such a sense that whether the patient has lost the consciousness for a time being, whether temporarily there is a loss of consciousness was there, and patient had any bleeding from the ENT, ear, nose, throat after the head injury, that will be taken into care. These all will definitely give out a very clear idea of the nature or the sort of injury it has taken place. So based on that, then of course with the support of the CT scan and MRI pictures, definitely we can come to a conclusion whether it is a purely infarct or whether it is bleeding, internal hemorrhage is there, or any fractures are there, skull bone, or whether any concussion is there, or there is any midline shift is there or not, there is any oozing excessive intracranial fluid is there or not. So many criteria will come into play. All these things will definitely taken care while deciding the plan of treatment.
Yes, sir. Moving on to the next topic. This is regarding Shilajit. We know that there's a reference regarding contraindication of Shilajit with horse gram. One is Ashmari Bhedana and another is maybe contributing to Ashmari. So can Shilajit be taken with Gokshura? So Gokshura is again Ashmari Bhedana in action. So can the rule of horse gram or Kulata be generalized to all the other lithotriptic or Ashmani Vedana herbs?
See, here there is a typical thing. Acharyas have mentioned while taking Shilajit, Kulatta should not be given. It was quoted with reference to the Rasayana Karma of Shilajit. For the purpose of Rasayana Karma, when Shilajit is given, at that time don't give Kulatta, which is Ashmarigna in nature. If here the intention of combining Gokshura with Shilajatu is to be considered first. For what reason we are combining? If we are combining both for the purpose of Rasayana, then it is not a right combination. If it is for something else, then there will be no, particularly for urinary tract issues are there, or improve the fertility pattern is there. Purpose, if you are using it, then there will be no issues. You can go ahead with that.
But Gokshura and Shilajit, especially with the gym people and who are always behind one or the other supplements, both are there. One of their favorite things. Even yoga people or whoever is doing exercises on a continuous basis, it is used generally as a balya medicine and also as an aphrodisiac therapy. Also, both are commonly used together, sir.
Now, as a balya, if you are using it to some extent, I think so it won't make any difficulty of this one, particularly when we observe the Rasaguna Virupaka of Gokshura as well as Shilajitu, it won't do any problems as such. But in case of Kulatta, it is entirely different when compared to Gokshura. So probably the Acharya was very specific in mentioning Kulatta should not be given if we are giving Shilajatu. But he was very much silent regarding the use of Gokshura. So definitely I don't think so it may cause any trouble as such. But if you want to have a Rasayana effect, it is your intention is that while using Shilajatu, then better almost based on the concept you can avoid mixing Gokshura with that.
Yeah, and moving on, this is one of my common complaints that Shilajit, whenever is suggested to a lady patient, generally they come back saying that, oh, this is used more commonly in men, but why are you giving it to me? So, I mean, similar to Shatavari for men, there is a taboo. There is this Shilajit taboo on usage of it on women. So, can you please elaborate on the use cases of usage of Shilajit in women, sir?
Definitely, Shilajatu can be used in case of women. See very clearly, people will try to understand the Shilajatu, its effect based on the testosterone. That's the reason why they have a taboo in using in a female. But whenever we try to use an Ayurvedic drug, it is not a single chemical thing. It is a complex material which has a lot of other issues too. When Shilajatu is given in case of a female, it improves her menstrual cycle, improves her hormonal balance, it improves her fertility chances. So definitely it is going to help because Shilajatu is one of the drug which is having a very good effect on Shukra Dhatu. And as per the technical terms, as per our Acharya, Shukra is the seventh dhatu which is present in both men and women. They never said it is Shukra is present only in men. So Shukra dhatu is present in both men and women, and Shilajatu has an effect on Shukra dhatu. So definitely Stri Shukra will be supported by using Shilajatu. Definitely by using Shilajatu, we can enhance the hormonal balance and fertility chances in case of a female. So there is no harm or there is no taboo or you should not be have any negative thoughts while prescribing Shilajatu for a woman. There should not be any such things.
Especially in Western countries that I've seen, this concept of Shukradhatu is generally understood or taught to the students as it's only for men. Probably it's a topic on its own that I also firmly believe that, if it is men or women, if it is human being, as long as it's a human being, Shukradhatu will surely be there. And there is a question regarding usage of Shilajit in BPH, benign prostate hypertrophy.
Shilajit in BPH. See, here In BPH, our intention is to improve the particularly that seminiferous ducts and such areas secretions, and even from the prostate secretions. So these secretion has to be improved. If these secretions improve, automatically the size of the gland will reduce. It is simply that organ is not in use. That's the reason it goes on increasing its size as in the, because men with a sexual activity will not develop usually BPH. The BPH is seen usually in men beyond the age of 60, when they are little bit away from the sexual activities or slow down, or of sexual activity for the time being has reduced. In such a persons, usually we do come across this type of things, and it is quite natural with the age. So in this condition, the intention of using Shilajit, Gokshura or Punarnava or something like that is to just to improve the Vata at the level of Mutra Vashrotas as well as even in the Purusha Vashrotas. So entirely trying to control, improve the functions of Apana Vata and improve the secretions from that area, which in turn will reduce the size of the BPH. So here in this situation, using a Shilajitu or a Gokshura or even Punarnava in that combination, it is not going to harm in any way, and it is good. It can be used.
But it is regarding the geographic tongue. The question is, what are the causes for geographic tongue? I also looked up. There are no specific causes mentioned for geographic tongue and depopulation as per modern science, and how it can be resolved. Vidanga has already been given to address the Krimi issue. So, how to approach geographic tongue, sir?
Geographic tongue usually represents there is a lack of Agni inside. Your Pachaka Pitta and Ranjaka Pitta is at stake. So very clearly the liver is being little bit sluggish, or digestive activity has a slowdown. So we need to just to improve the digestive activity by using Deepana Pachana Dravyas. So at our disposal, Deepana Pachana Dravyas here in this sense is, one is Jiraka, other one is the Shunti, then Chitraka, then still there are drugs we can use it like Gajapipali, Shunti, Jiraka, Gajapipali, Chitraka. These drugs can be used to improve. Even Brungaraja, even along with that Brungaraja you can use it, even Kalamegha. So these drugs will definitely improve the Agni, and in turn they will even reduce this geographic tongue.
Thank you there, sir. And another question, what can be the Ayurvedic line of treatment for prostate cancer?
So see, it's a big topic, and we need to understand that whenever there is a cancer of this nature, we need to go for advanced technique of understanding it using imaging techniques. We need to go for a PET scan. When we do PET scan, we'll come to know the extent of the disease, which is whether it is locally present or whether it is beyond certain things. And prostate cancer is a very really challenging one, and once if we confirm that the disease is confined to only prostate, then the important thing is that the removal of the prostate. And while removing the prostate, definitely they will try to even remove the testicles as a precautionary measure, because it is going to cause problem. When they remove testicles, then definitely they need to give some testosterone directly to maintain the manhood for the purpose of that. So there is a lot of issues with that management techniques what the modern medicine uses. From the point of Ayurveda, it is very clear. If it is localized or anything like that, we can go for penetrative drugs which can treat these two things to some extent. But in my opinion, if at all, if it is localized, better thing is Shalya Karma. Just refer the patient to concerned oncologic surgeons. Let them take a chance and let them clear the disease primary lesion. If a primary lesion is removed from the body, that is reducing the burden on the system. If you allow that primary lesion to remain inside the body, then it has all the chance of giving out the spores of cancer cells. They may tend to move through the various channels. It may be lymphatic channel or blood channel. It moves. So it is better to avoid it. Many times it is seen that even though it is a prostate cancer, in a very short time the lesions will be seen in the brain. It is a very long distance. How it has reached the brain? Then it is come to know that because very short distance it reaches to CSF at the level of lower end in the lumbosacral region, and through the CSF it reaches to the higher center very easily, and there it starts multiplying and the lesions become spread all over the body and the metastatic lesion will conquer. So that's the reason we should be very very careful in handling these things. Better it should be handled by a group of people, and of course with the support of those people who have the ability, even legal protection and the skills to operate these patients. And later in the part, to improve the immunity part of it and improve the, and wherever the drugs, modern medicines and the drugs have been given and even the radiotherapy has been given, complications out of that, those things can be handled effectively by using Ayurveda.
Thank you very much, sir. Moving on to the medicines that are given for the treatment of constipation. In the last class, you had elaborated very well regarding various choices we have for the treatment of constipation. One of the common problems that I personally feel is whenever laxative medicine containing Tribulus or Jamal Gota or Croton Tiglium is given, usually it causes twitching type of pain and abdominal colic pain in the patient. So, what are the safer laxatives which can be given for the treatment of constipation that do not cause any twitching pain but as effective as Tribulus or Croton Tiglium? Sir.
See, first of all, before selecting any drug for any condition, we need to ascertain that particularly this patient is suffering from what condition and what is the intensity of that lakshanas, roga lakshana as well as roga bala, that has to be considered. If you feel that roga bala and rogi bala both are stronger on the higher side, then definitely we can select a very strong drug which contains like Jaypala or something like that. If it is not so, a person has developed this constipation for a quite short time and due to some time from the just few days or few weeks, then we can go for a milder form of things like even simple Haritaki Choorna can do the things, and even Swarnam Patri containing drugs can be used, and even the drugs with Katuki can be used. Such type of things are also will definitely help us. But many times we find that there is a crura costa in that patient, and when the costa is crura, when you give Trivrit and Jamal Gota or chlorantaclone containing drugs, I don't feel that it's going to cause you any twitching problem. If a twitching problem occurs means there is a little bit of error in our calculation of constipation, what should be given, how much should be given, where we might have made some little bit of things. So it is better than if already we are thinking that based on some parameters we have selected a drug and given, but still patient develops a twitching type of pain. Then how to overcome this twitching type of pain? That's a simple thing at our disposal for this twitching type of pains is one is Hingu, the other one is Jiraka. So we can use Hingu and Jiraka for this purpose to overcome the twitching pains.
If you reduce the amount of Tribulus that is given, probably the twitching pain can go away in some patients with constipation.
That's the reason I said while calculating the dose, we might have done some error. That's the way the patient is getting twitching. So whatever the dose you have fixed, either you reduce the dosage, and if you reduce the dosage, you feel that result won't come, then give the counter for the twitching to avoid that by using Hingu or Jiraka or something like that.
So please tell about a treatment for GB syndrome, whether we can give good results. GB syndrome is Guillain-Barré syndrome is defined as a polyneuropathy, and it's an autoimmune disorder where our immune system is attacking our peripheral nerves and leading to destruction of myelin sheath. So this is just a brief outline on treatment and few possible medicines. This is not elaborate thing on GB syndrome. Your thoughts on GB syndrome management, sir, please?
Definitely, it is not a simple type of disease and which can be easily manageable. It's not like that because many GB syndrome patients require a lot of medication and will be ICU patients many a times. It is not as simple as a OPD level treatment. It can be done. Once there is a stabilized patient after the GB syndrome, say about 5 days, 10 days later on that, once the patient is stabilized, then we can start off with our rehabilitative course of medicines wherein we try to improve the person's immunity as well as similar Vata Hara line of treatment. What is we are supposed to do it for the Pakshagata or something like Ardita. Similar type of line of treatment also supports in this case of GB syndrome. And we have seen many times some viral infection leading to GB syndrome and causing a nerve damage, all these things. But when such type of things are there, then we'll go for general line of treatment like Nasya, we go for Abhyanga, we go for Shastika Shali Pindasveda, and we go for Patrapindasveda, something like that. Abhyanga and all these type of things. So definitely, by doing this one and continuously for many months, we may have to do it. Then the results will be good.
And there is another question. Yeah, this question is regarding when the scans such as CT scan and MRIs are done, is it something that can be done to help bring the body back to normalcy after X-ray radiation? First of all, this MRI scan will not expose the person to any kind of X-ray radiation, but CT scan does. And there is this famous instance in the medical world that previously breast cancer was very frequent, and the medical fraternity of yesteryears, they came up with a theory that all the women after a certain age, maybe about after 40, should undergo mammogram or the CT scan of the breasts once in 6 months or once in a year. But once that was done continuously for many years, and because it is done repeatedly for many years, that itself, that X-ray exposure itself was causing breast cancers. So it was like counterintuitive, and in our own diagnostic procedure causing a disease for which the diagnostic procedure was done. This question can be elaborated to excessive computer use or excessive Wi-Fi radiation and all. So X-ray radiation or many sorts of radiations we are continuously exposed. So how to maintain balance? How to how Ayurvedically sort of detoxify and cleanse out these radiations out of the body?
See, detoxification is the same process which we are saying that seasonal detoxification. That's what we call it in Vasanta Rutu, Vamana, Sharad Rutu, Virechana, and Varsha Rutu, Basti. These are things what has been told in Ayurveda. They are nothing but seasonal detoxification and cleansing, which cleanses all these things. Very clearly, we need to understand this. We are exposed to sun rays are there. Even there is a lot of radiation. We need to understand that radiation is going to cause damage to us. There is a difference between ionizing radiation and a non-ionizing radiation. So definitely we are being covered with lots sort of radiative things around us. Of course, these type of X-rays and CT scans do have a negative effect, but when patient is at stake and is in such a condition that it is very much necessary, then we need to go for it. Whereas this screening techniques of that is like mammography and something like that, it has to be periodically done. I am against to that. See, there is a very clear cut indication. Usually, what we have observed is most of the cases of breast cancer, they have a familial tendency. So those somebody earlier in their family has some breast cancer or colon cancer, then there is a chance of you getting the cancer. There's a chance of more cancer in you. So in such a patient or such a family history or supporting background, if it is there, then cautiously by using maybe yearly once or something like that, or periodically breast examination, then any suspicion if there is there, then you can go for it. Simply just the doctor has told that you need to go for every 6 months. It is just something like that. We are checking the blood sugar. No, it should not be done. It should not be done in that sense.
Yes, sir. And nowadays there is also studies to conduct genetical studies or genetical investigations that can be done to ascertain whether a person is prone to cancer or not. So very famous example for this is Angelina Jolie, a famous Bollywood Hollywood actress. So I mean, her mother died due to breast cancer, and at the age of 56, and Angelina Jolie had an 87% risk of getting breast cancer. So she was not having cancer, but because of higher chances of getting breast cancer, she underwent breast removal surgery. So that's kind of other type of extreme procedure there, sir.
That is not a right way of doing things. For the sake of somebody is getting something like that and trying to remove some organ from a body, it is not at all a right way of doing things. You see, all these techniques are present only to have a better life. But you should not simply out of fear make certain things I may get some speakers when the age of 60s or 70s, you may die. For that purpose, if somebody, oh, anyhow, I'm going to die, but now only I will die, then what is the use of it? Such type of argument doesn't take you to anywhere. So it is not the right kind of doing things. These type of techniques and evaluations is only to just to assess the risk. If it is risk is there, then it has to be periodically monitored as much as possible with the non-invasive methods. Only there is on a very high suspicion, then you go for the invasive things and finalize it. So I don't recommend that you should go periodically checking it out. There are methods which can be done in a non-invasive way. There is a suspicion, there is a family background, a supportive history. Then be cautious. That's it. It doesn't mean that don't unnecessarily be in a state of fearfulness and present will be spoiled unnecessarily. We're thinking in those lines. It should not be.
Yeah, some medical sciences, some medical procedures, and some medicines are there exclusively to create fear and opportunities out of that. Like you said, I mean, maybe for X-ray radiations, maybe for mental stress, we are exposed to a lot of our foods are not so as pure as previously. Probably the answer for all these things is, like you said, undergoing regular shodhanas, following dinacharya, starting from Abhyanga to Kavala, Gandusha, oil pulling, nasal drops, exercise, healthy diet, fasting from time to time, and also undergoing seasonal panchakarmas, changing our diets as per season. Following Rutucharya and following Dinacharya would address most of our issues, even the genetical predisposition to cancers.
Definitely, when we go for such type of procedures of basic principles adopted by the Ayurveda, and if you follow it to a maximum extent, definitely we will be benefit out of that, and that benefit will be in the form of longevity. So definitely, that is a disease-free longevity will be one of the things. But still, many times there are certain issues. Certain times, even anybody can err in calculation, and even because many times the patient comes to us saying that I have not smoked, I have not taken drinks, and I have not done any nonsense, but still I get a cancer. What is the reason? So it's very difficult to convince them that what is the reason. Maybe there are multiple factors involved. Maybe the food material what we're using, and we don't know that from where it is coming, and what are the chemicals they have been used as a pesticide or a ferticide, insecticide, what they use. We don't know what exactly, even for in order to improve the productivity, how they are using enzymes. We don't know how their outcome. For example, there are issues like if market demand is there for shunti, there is some enzyme which is there in the market. They'll spray the enzyme to the leaves directly. Next day or two, the shunti will come in such a bulk and it becomes heavy and it erupts out of the ground, and they will take it and use it. And these things are, it's not like just like how they done it for the cows, the udder of the cow, and it just has to give milk. They didn't improve the thigh muscles or the bone strength of the cow. They made a genetically somewhat changed cows, Denmark or Jersey cows, and made that udder such a big that it should give 30 liters or 60 liters of milk per day, something like that. So this is not a right kind of using a science and technology. It should be for the human kind. It should be done in the natural way as far as possible.
Yes, sir. And another question is Sandhya ji asks, can you please elaborate on miscarriage management that happens between 5 to 6 weeks of gestation? So, if it is just 5 to 6 weeks, we have to ascertain whether the pregnancy was confirmed. So, let's assume that the pregnancy was confirmed, but within 5 to 6 weeks of gestation, there was miscarriage. Or of the other things like vata management and all, probably the mental health of the lady patient should also be addressed. So, how to go about this, sir?
See, first of all, we need to understand that certain terms in modern medicine or the Western medicine they use in a very typical manner. Anything which is content of the fertilized thing which goes out of the gestation period, once it is confirmed within a particular period, then they use a term abortion. Miscarriage is a term used, it is the first trimester or at the end of the first trimester after completion of the 12 weeks, something like that. So we need to understand that what is our intention of asking the question. If the intention is that abortion is the intended thing they wanted to ask, then let me clarify. First of all, as you said, we need to confirm there was a pregnancy. That is the first point, number one. Then by evaluating the history, we will come to know that last menstruating period when it was, calculate accordingly. And if you have any supporting document of any primary confirmation or gestational sac or something like that, by scan, if it is there, you just observe that. Then afterwards, if a patient complaining of per vaginal bleed, once there is a confirmed case of pregnancy, then anyhow we have at our disposal, there is ultrasonography, send the patient for the ultrasonographic scan. Definitely it gives us an idea whether it is abortion, whether the concept of pregnancy has detached from the thing, internal bleeding, everything, we can very easily catch it by the ultrasonography. Then if it is already detached, nothing can be done, evacuation is the only method, then allow it to go completely, let it clean the things, then we need to give garbhashya shodhana dravyas which will clear the things. So garbhashya shodhana means here once again jiraka, ashoka, that type of drugs should be given that will help to remove the contents or even the rajapravartini because it's already gone. We cannot in any way going to safeguard the pregnancy. Then it has to be cleared. Otherwise, if a partial abortion takes place and the remnant remains inside, there will be continuously bleeding will occur. So that should be taken into consideration. Once that is there, then we need to go for complete evacuation of the fertilization. Once it is cleared, then we need to go for garbhashya shodhana dravyas in the form of Dashamoola Kvata or even in the form of Jirakagarista, Ashokarista and such other things. Cleanse it very clearly. Then patient should be advised not to conceive for the next 3 to 4 months. Such type of gap should be maintained. Then accordingly, whatever the treatment has to be given, you initiate. If a patient, then you can go for what do you call understanding the history of the patient, whether patient is having any substantially repeated abortions are there. Putragni yoni vapat we call it as. If it is something like that, then it has to be checked out. And if it is not such type of things, then no issues. If it is the first time it has happened, or second time, or third time, multiple times. So all these information definitely help us to plan the protocol, what can be done and what way it should be done. Then we need to go for the strength of the pelvic region, pelvic girdle, and even in the cervical incontinence, they call it as many times in many cases. So such type of things. Then we'll go for yoni pichu, yoni prakshalana, then bastis or something like that can be given to improve the health of the pelvic region, including the genitourinary system. And certain grutha can be given like phalagrutha or phalasarpi, such type of things can be given. So which will definitely going to support the pregnancy. Once these things are done, then after the 4 months, then we can advise the patient to have a trial for the pregnancy.
And whenever miscarriage or abortion happens, the couple may be in a hurry to try for the next child. Like you told, giving a gap of 3 to 4 months or even 3 to 6 months is so very important, so that mentally they recover, both the couple, and also the physically, also the general immunity and the overall body nourishment improves, and the uterine health and reproductive health, we can create a better environment, reproductive environment, so that there are better chances of conception and sustained pregnancy and childbirth, like you said.
Definitely, that is the reason they use it, because once there is an abortion, there will be injury to the musculature inside. It requires a lot of time to get healed and all these things. Once it is, at least a few cycles are required to improve that condition. And of course, when there is a history or twice there is an abortion, then we may have to think of that this patient may go for putragni yoni vapad, then accordingly we need to handle her by counseling as well as giving some Vata dravyas and improve the pelvic related areas or apana vayu kshetra, that should be properly nourished and maintained, and Vata has to be controlled, and these type of concept has to be built in, and make both the couple ready for the next pregnancy after 6 months. A good way of handling their stress as well as improving their bodily nature and improving their bodily strength and efficacy in order to have the proper pregnancy later on, which can be sustainable till the last day of pregnancy.
Yes, and Deepthi writes, Shilajit is of very light color in Rajasthan, Sindh and Gujarat area. It is called Churiro Bhatto. It is given to women after delivery for sure, but it is consumed in a delicious laddu form, both by men and women, to improve strength and vitality during winter for 6 to 12 weeks. After childbirth, has its uses in women to strengthen the ligaments and the overall strength of the muscles of uterus as well, sir?
It can be. It is a generally balya dravya, rasayana dravya. It can be used in that sense. Of course, it's not be given singly. It will be used in the form of some laddus, and they prepare it. There are a lot of other things to be added. So definitely, in Rajasthan and these areas during winter, it's a very high time for energy consumption. If you are in Rajasthan and Delhi and such type of areas in winter season, you will have a lot of appetite. You are hungry, you will be more and you will be eating more, because a lot of energy you are losing to maintain the cold. So that's the reason the people will give a lot of other things. Even the even winter they'll use a lot of and even tila, lot of tilpatti, tilaladdu. They will use so many things in the northern India during winters in order to maintain the temperature, proper nourishment as well as temperature, because the energy consumption will be more in the body during those periods.
Probably last question for the day. For children between 2 to 8 years of age with constipation, what are the best herbs to choose?
See, for 2 to 8 years, it is better you go with dry grapes first. That will be because it is going to give them sufficient snigdhata to the costa. If you are feeling it is a cruda costa or constipation, avoid all those stuffs which can become having a katuyapaka, like bakery stuffs, bun, bread, and such pizzas, these type of things. And even consuming of those less water is also one of the criteria. All these to be addressed first. That in the name of herb, what you can give is the best one will be dry grapes. If you soak 10 dry grapes in the water in the night and give it in the morning, next morning, on empty stomach, and make it in a habit regularly, this will provide a sufficient gut snigdhata, which will support the evacuation. One thing, of course, it also improves the absorption and assimilation. Then the other drug would be improving with the help of estimadu. You can use extent estimadu kshirapaka, that also gives it. Then because of this age group, the last option would be triphala. You can go for triphala because triphala is comparatively stronger among these things for that age group.
Especially with children of 2 to 8 years of age, we should be like very careful using stronger medicines like Ayurvedic, Choorna and all. Improving the bowel habits, improving the intestinal health should be our main aims and objective, and not treating constipation, because if we give like stronger herbs, they may get they may damage the intestinal tissues, at a very early age, and it's not a, such a precaution is very highly recommended, sir.
Definitely, that is not an intended herb to be used in those age group, and it is not required also because there will be sufficient snigdhata. Maybe due to some food habits and some habits, it has increased and the constipation has occurred. So, just to understand what may be the reasons, then accordingly we can go for a reduction. And better thing is that dry grapes.
Yes, sir. So that ends the list of questions that I had come in my way. So thank you very much, Guraja sir, for attending all our questions. Overall, thank you very much, sir, for this valuable session.
Thank you one and all for patient listening.
And thank you everyone for your active participation and interesting question. See you. This is the Gurubodha session we conduct every Sunday at 7 p.m. See you in the next episode next Sunday, 7 p.m. Namaste all.